Hi everyone, welcome to today's workshop. Today's workshop is going to be on ovarian cancer. What is ovarian cancer? Ovarian cancer is a group of diseases that originates in the ovaries or in the related areas of the fallopian tubes and the peritoneum. Is ovarian cancer life-threatening? A cancer that begins in the female organs that produce eggs, ovaries. Ovarian cancer often goes undetected until it has spread within the pelvis and stomach. At this late stage, ovarian cancer is more difficult to treat and can be fatal. Does ovarian cancer have symptoms? Ovarian cancer often has no symptoms in the early stages. Later stages are associated with symptoms, but they can be non-specific, such as loss of appetite and weight loss. Surgery and chemotherapy are generally used to treat ovarian cancer. What can I do to reduce my risk of ovarian cancer? There is no known way to prevent ovarian cancer, but these things are associated with a lower chance of getting an ovarian cancer. Having used birth control pills for 5 or more years, having had a tubal litigation, that is letting your tubes tied, both ovaries removed, or hysterectomy, or an operation in which the uterus and sometimes the cervix is removed. Having given birth, breastfeeding, some studies suggest that women who breastfeed for a year or more may have a modestly reduced risk of ovarian cancer. These things may help reduce the chance of getting ovarian cancer. They are not recommended for everybody, and risks and benefits are associated with each. What are the symptoms of ovarian cancer? Vagina bleeding, particularly if you are past menopause, or discharge from your vagina that is not normal for you. Pain or pressure in the pelvic area. Abdominal or back pain. Bloating. Feeling full too quickly or difficulty eating. A change in your bathroom habits, such as more frequent or urgent need to urinate and/or constipation. How to diagnose ovarian cancer? The following are ways to diagnose an ovarian cancer. Pelvic examination. During pelvic exam, your doctor inserts gloved fingers into your vagina and simultaneously presses a hand on your abdomen in order to feel or palpate your pelvic organs. The doctor also visually examines your external genitalia, vagina and cervix. Imaging tests. Tests such as ultrasound or CT scans of your abdomen and pelvis may help determine the size, shape, and structure of your ovaries. Blood tests. Blood tests might include organ function tests that can help determine your overall health. Your doctor might also test your blood for tumor markers that indicate ovarian cancer. For example, a cancer antigen test can detect a protein that is often found on the surface of ovarian cancer cells. These tests can't tell your doctor whether you have cancer, but may give clues about your diagnosis and prognosis. Surgery. Sometimes your doctor can't be certain of your diagnosis until you undergo surgery to remove an ovary and have it tested for signs of cancer. Treatment of ovarian cancer.
Wow.
Treatment of ovarian cancer usually involves a combination of surgery and chemotherapy. Surgery to remove one ovary. Surgery may involve removing the affected ovary and its fallopian tube. This procedure may preserve your ability to have children. Surgery to remove both ovaries. If cancer is present in both your ovaries, but there are no signs of additional cancer, your surgeon may remove both ovaries and both fallopian tubes. These procedures leaves your uterus intact, so you may still be able to become pregnant using your own frozen embryos or eggs, or with eggs from a donor. Surgery to remove both ovaries and the uterus. If your cancer is more extensive, or if you don't wish to preserve your ability to have children, your surgeon will remove the ovaries, the fallopian tubes, the uterus, nearby lymph nodes, and a fold of fatty abdominal tissue. Surgery for advanced ovarian cancer. If your cancer is advanced, your doctor may recommend chemotherapy followed by surgery to remove as much of the cancer as possible. Chemotherapy. Chemotherapy is a drug treatment that uses chemicals to kill fast-growing cells in the body, including cancer cells. Chemotherapy drugs can be injected into a vein or taken by mouth. Sometimes the drugs are injected directly into the abdomen, intraperitoneal chemotherapy. Chemotherapy is often used after surgery to kill any cancer cells that might remain. It can also be used before surgery. Targeted therapy. Targeted therapy uses medications that target the pelvic vulnerabilities present within your cancer cells. Targeted therapy drugs are usually reserved for treating ovarian cancer that returns after initial treatment, or cancer that resists other treatments. Your doctor may test your cancer cells to determine which targeted therapy is most likely to have an effect on your cancer. Early detection saves life. Know your body's symptoms today.